Hello, my name is Dr. Bob DeMaria, the Drugless doctor with Get to Know Frequently Asked Questions. Thyroid challenges. 72% of you watching me right now, anywhere in the world, are not getting enough iodine in your body. And you're taking a medication because you're dealing with or contending with low thyroid. For those of you that have never been formally diagnosed with low thyroid, let me present to you some of the very more obvious body signals. Do you have cold hands, cold feet? Do you wake up in the morning with a headache? As the day goes on, the headache goes away? How about thinning of your eyebrows? Yellow teeth? Thinning hair? Constipation? Very common. Cholesterol that does not want to go down no matter whatever you're doing. Fatigue and depression. Those are common body signals for a low thyroid or subpar thyroid. So what do you do about that? How do you get off of Synthroid or any of the other generic medications? First, always talk to your prescribing healthcare provider. This is some of the things that I would do if I was you. There's a blood test called TSH, Tom, Sam, Harry, T3, Tom 3, and T4. Request your healthcare provider to run that test for you. Your TSH should be above 2. If your TSH is in the area around 10 or so, you officially have a low thyroid gland. Critically, 2 other lab values that are important are the T3 and T4. The T4 should be right smack in the middle at about number 8. But what's one of the most common low thyroid challenges that I see in my practice is someone who has a normal T4, as I mentioned to you, around 8, or the midpoint, depending on your lab, but their T3, their Tom 3, is on the low side. If you want to get off your thyroid medication, if you want to improve subpar thyroid function, you have to improve the conversion of T4 to T3. Common body signals, the common reasons for that to occur. How much stress do you have? Do you have freckles on your face? Body signal of too much copper. Copper stops the conversion. So does lack of zinc. Zinc is depleted by the body because of wheat and soy products. So what do you take? First, do not stop your medication. I would encourage you to start with iodine. The Japanese population, when I spent time in Japan, they consume about 12 milligrams of iodine every day. I would start off with a half a tablet or about 6 milligrams of iodine and do that for a week or 2. Iodine will push bromine, fluorine, and chlorine out of your body. If you've been exposed to or spent a lot of time in hot tubs, swimming pools, obviously if you take showers, the iodine may cause a skin rash in your body, maybe a metal taste. Those are not bad signals. It's just telling me that your body is starting to function optimally. For all of our thyroid patients, we always encourage them to take at least a half a tablespoon of flax every day, or 1 tablespoon per 100 pounds, at least starting off with 6 milligrams of iodine, taking up to 12 milligrams of iodine every day. And then you may want to get a multiple mineral tablet that's going to have some selenium in it and zinc. Avoid wheat and soy. Soy is an anti-thyroid food. Let me talk to you about high blood pressure. High blood pressure medication is being consumed by so many millions of Americans today. High blood pressure. The 120 number is called the systolic number. The 80 number is the diastolic number. It's the amount of pressure that your heart has to push that blood throughout the body. That is the systolic or the 120 number. If that number gets too high, it's very possible that you may have a stroke. The other number, the diastolic number, is when all the blood goes back into the heart from the resting state and it pushes up to the top part of the heart. That's the resting pressure that the heart has to contend with. What we encourage our patients to do, 2 or 3 items here. For every pound that you're overweight, it adds 200 miles of extra blood vessels to your body. Your heart has to work harder if you're overweight. 200 miles of extra blood vessels for every 1 pound. What a common cause for high blood pressure, from my experience, is when you have high insulin in your body. You get high insulin from eating sugar. Sugar causes more insulin, which causes sodium retention. Sodium causes more water to be held onto by your body. Your blood pressure will go up. I know that some of you have been taking water pills. Well, by taking and eliminating the sodium or sugar and drinking more water, you're going to flush those toxins out. You'll be pleasantly surprised to know your blood pressure will go down. We also encourage vitamin D for our patients with blood pressure, high blood pressure, because the vitamin D helps the absorption of calcium from the body. Calcium is a natural smooth muscle relaxant. So vitamin D, start with anywhere from 2,000 to 5,000 international units of vitamin D on a regular daily basis. You may in fact want to have your vitamin D tested. Drink more water, eliminate sugar, take vitamin D, start with 2,000 to 5,000 international units every day. Blood thinners are a major issue. How do you get off those blood pressure or blood thinner medications? I can tell you this. I would encourage you to use oil, flax oil. We have a blood spot test in our office called the essential fatty acid test, where we can assess your essential fats. What we have found with people who are taking blood thinners is that they have a lot of inflammatory fat inside of their body. I would avoid trans fatty acids. Those are the fatty acids that are found in most snack foods. Trans fatty acids cause inflammation, cause blood vessels to stick together, blood cells to stick together also, and that's one of the reasons that your healthcare provider will encourage you to take a medication to thin your blood. It's not a very easy medication to take off of. I would always talk to your healthcare provider. A simple step is essential fatty acid testing. It's a blood spot test. That test will tell you exactly what areas that you need to watch. We usually encourage our patients to take a marine-based oil like anchovy oil or sardine oil combination. I personally take 2 teaspoons of that every day. If you're noticing a lot of bruising on your hands and your arms and you're taking these blood thinners, that could be a simple way for you not to do that anymore. Osteoporosis is really quite easy to be taken away from those medications. Add more stressful exercise, a little bit of weight training. That will help your body have more calcium deposit on bone. Stay away from soda pop. Soda pop depletes your body of calcium. You see, the osteoporosis medications work by tricking bone cells in your body called osteoclasts from doing their job. So when you're on these osteoporosis medications, you're really creating fragile bone. I would increase calcium in the form of almonds and walnuts and leafy greens. Cut back on soda pop, eliminate soda pop, drink more water. Also for you ladies that are taking osteoporosis medications, flax oil. 1 tablespoon of flax oil per 100 pounds will help the hormones in your body function optimally, holding on to all that calcium. You want to make sure that you're participating in some stressful exercise. Not exercise that causes stress to your mind, but some weight training with some weights, with some bands, because you want to increase the stress to the bony structures inside of your body so your body will redeposit bone. It's very simple to be able to get off of some of your medications. You're going to want to review this video again, talk to your prescribing healthcare provider, but I want to share this with you. You do not want to go off of the medications without you making any appropriate and necessary lifestyle changes. To create a strategy, you need to change what you're doing right now, and by doing that, I can promise you that you won't have to contend with and deal with those negative effects from all those medications. I'm Dr. Bob DeMaria, the Drugless Doctor, getting to know and answering those questions to get off of your medications.